So now we'll be discussing Child Pug Score or CPS. Now we must know Child Pug Score is one of the most important score which is very commonly used by gastroenterologists, which is very commonly used by transplant surgeons, liver transplant surgeons, and this is a very interesting score. Now it was basically designed for predicting mortality in cirrhotic patients, and it has been divided into category A, category B, and category C. Category A, it tells us that the patient still has good hepatic function. Instead of cirrhosis, the patient still has a good hepatic function, and the outlook of the patient is usually better. Category B, they usually have moderate to impaired hepatic function. So these patients are potential candidate for a very proper treatment, and they may have a good life if everything is well balanced. And category C, they usually have a very advanced hepatic dysfunction, and such patients usually won't do good, and such patients have usually very high mortality, and they may have a lifespan of around 1 year or 2 year or 3 year. They may die of complications very fast. So to calculate this child pug score, we take into account total five things, out of which some are clinical and some are lab based. So the clinical is ascites, presence or absence of ascites. So if the patient has no ascites, we give a score of 1. If the patient has slight ascites, or if the patient's ascites is very well controlled, we give a score of 2. And if the patient has moderate ascites, or if the patient ascites is not very well controlled even on medicines, we give a score of 3. The second thing which we see is the bilirubin level in the blood. If it is less than 2 milligram, we give a score of 1. If it is between 2 to 3, we give a score of 2. And if it is more than 3, we give a score of 3. The third thing is presence or absence of encephalopathy. If patient is well oriented, walking, talking, no confusion, doing calculations, doing mental tricks, if the patient is good, if the patient has no diurnal variation, if the patient is sleeping well at night and staying awake the whole day, then we say that the patient almost has no encephalopathy, and the patient is given a score of 1. If the patient has grade 1 to 2 encephalopathy, where the patient will be confused, there will be some problem in remembering, there will be some problem in doing calculations. The patient may be disoriented for some of the time, but usually patient is talkative, patient talks, patient gives reliable history, or patients communicate very well with the doctor. At that point, we can give a score of 2. And score mm, 3 is given when the patient has a very bad encephalopathy, where patient may have so much of flapping tremors, patient can be comatose, or patient may be in altered mental status. There can be marked confusion, or patient may be disoriented at all the point. There may be significant lapses in his memory. Patient may not be able to remember. Patient may have hallucinations or delusions or a disorientation at all the time. So we give a score of 3 in such patients. We know that whenever we talk about CLD or liver function, albumin is the first thing that comes into the mind, because reduction in albumin takes at least 1.5 months to 3 months. So if albumin is more than 3.5 gram percent, we give a score of 1. When it is in between 2.8 to 3.5, we give a score of 2. And when it is less than 2.8, we give a score of 3. And the last thing is the prothrombin time prolongation. If the prothrombin time prolongation is not much, if it is less than 4 seconds, we give score of 1. If the prolongation is between 4 to 6 seconds, we give a score of 2. And if the prolongation is more than 6 seconds, we give a score of 3. If the prothrombin time prolongation is not available, we can calculate the same thing on the basis of INR. If INR is between less than 1.7, we give a score of 1. If it is between 1.7 to 2.2, we give a score of 2. And if it is more than 2.2, we give score of 3. So on the basis of these three things, we calculate the Child-Pugh score. If the score is between 5 to 6, we say that patient has good hepatic function, and we give A grading. If it is between 7 to 9, we put the patient into B, And if the score is between 10 to 15, we say that the patient has Child-Pugh score C. Now, this Child-Pugh score was actually designed for allocation of a cirrhotic patient for liver transplant. But what the problem had happened, that uh, the patient with bilirubin 14 and INR 6 and any other patient of bilirubin 4 and INR 2.3 would actually have the same Child-Pugh score as per this data, because both the patients have bilirubin of more than 3 milligram, and both the patient have INR of more than 2.2. So both the patients will have same Child-Pugh score, but both the patient may have totally different, or they may have significant change in their liver capability. So this was one of the limitation of Child-Pugh score. That was the reason the MELD score came into the picture. But still, this Child-Pugh score is very commonly used for as a predictor of post-operative mortality after portocaval shunt surgery or any other major operation in any cirrhotic patient. So, in short, after an abdominal surgery or after a surgery in a cirrhotic patient, if the patient had a Child-Pugh score of A, the chances of mortality will be around 10%. If the Child-Pugh score is B, then the chances of mortality will be around 30%. And if the patient has Child-Pugh score C, the chances of mortality after such abdominal surgery or major surgery or a portocaval surgery will be very very high. It will be around 70 to 80%. So elective surgery in Child-Pugh score C should be contraindicated or should not be done. It also predicts the mortality risk and development of other complications from liver dysfunction, because these patients are then, if the score is C, then the chances of gastroesophageal varices, ascites, spontaneous bacterial peritonitis or bacterial peritonitis or hepatic encephalopathy or secondary infections or community acquired pneumonia or any other immunocompromised infections. All these complications will be much, much higher in C than B than A. Uh, it can be also used for predicting the survival. If the patient has Child-Pugh score A, they usually 100% of the patients will usually survive for 1 year. If the score is B, then around 20% patients may die within 1 year, and if the score is C, then almost half of the patients usually die within 1 year because they usually have a very 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 bad hepatic dysfunction. Now, this Child-Pugh score definitely has some limitations as it does not take into consideration renal parameters. If someone has HRS or if someone has a bad creatinine level, then the patients may die very, very fast, even if the patient has a Child-Pugh score A. So it doesn't take renal parameter into account. This is one of the limitation of Child-Pugh score. And the scoring of encephalopathy or ascites is kind of subjective. There is no objective rule to this. So the Child-Pugh score may vary from person to person or from doctor to doctor based on their subjective scoring. And actually, it does not differentiate or distinguish between different causes of chronic liver disease, such as alcoholism versus Wilson's disease, or because of some drug-induced CLD, because of the autoimmune disease. So that may vary, and the same scoring of Child-Pugh score in a patient with different etiologies of CLD may not be very relevant. And the last point, that there is wide inter-individual variability among patients assigned in the same group. For example, if a patient has bilirubin of 14 and INR of 6, and if some other patient has bilirubin of 4 and INR of 2.3, these patients will be almost always put in the same class because the bilirubin is more than 3 milligram and the INR is more than 2.2. So it doesn't matter whether this is 14 or 16 or 18, or whether this is 3 or 5 or 6. These patients will be put in the same Child-Pugh score, but this doesn't actually match, because the patient who has higher bilirubin definitely has a chance of having a very bad hepatic dysfunction. So this was all about child pux score, and thank you.